Welcome to Kitchen Table Conversations, a series of short and shareable conversation starters for those of us who have or love and support people with a complicated and beautiful brain. Here's your host, Angela Geddes.
Hi, everyone, and welcome to another edition of Kitchen Table Conversations. Thanks so much for tuning in today. I'm Angela, and today I want to talk about something that might not feel like a regular or a typical mental health topic, but it absolutely is. Today we're going to talk about oral health. I usually spend a little bit of time every morning reading Apple News and from a variety of different sources, and just came across this article in Science Focus called Watch Your Mouth, and it was written by Alice Lipscomb Southwell, and it speaks about the implications of oral health on our whole body. So this is actually an area of passion that goes back many, many years for me, to my time working at the West Elgin Community Health Center. As a matter of fact, I had the opportunity to be part of a research project and many focus groups alongside public health teams and government partners. And what we were trying to understand is, what are the real oral health needs in our community? And why are so many people falling through the cracks, and what can we do to make it a little bit more accessible? I remember, as part of my work, going around to a variety of different dental offices and asking questions around what did we do for people who weren't able to afford some of the services that were offered. And it was kind of stunning, actually, because many people that I asked didn't really think about that, because they didn't really come across that problem, which led me to understand very clearly that people who couldn't afford to go to the dentist just simply didn't go. So they didn't go and ask for any kinds of, assistance or a sliding scale or that kind of thing. They just didn't go to the dentist. So they really didn't know where to refer in terms of, Western or Fanshawe colleges to go and see students, for example, to reduce the cost and to build skills. Those things were not really considerations. And so again, what I learned during that time stayed with me, and because this oral health is not just about vanity. As a matter of fact, it was never about vanity. This was about health and dignity and connection to people and to communities. I can remember young moms who lost their teeth during a pregnancy, and this sometimes happens. There's a calcium depletion, and it's nobody's fault. It's not because they didn't care or take good care of their teeth. It's not because they weren't trying, but because of lack of access, and sometimes nutrition, sometimes stress, sometimes systemic gaps, a variety of different reasons, these things happen. And instead of support, what I learned was that they felt very judged harshly. These were the moms who stopped going to school events because they didn't want to embarrass their children. These are the moms who wouldn't go outside to play because their teeth and their mouth hurt when they stepped outside in the winter. And then there were grandmothers who wouldn't smile at their grandchildren, not because they didn't feel joy, but because they were afraid of how they looked, but also, unfortunately, their look frightened their grandchildren. And that, to me, it obviously made me very sad to hear their stories. But they got quoted for dentures that were upwards to about $10,000, and they just maintained that they could shut their mouth and save $10,000. And that was their rationale. And so what we started to see was a bit of a ripple effect, however. So there was, some isolation, some increased mental health consequence, strained relationships, and kind of a loss of identity, and certainly a loss of confidence in many people. So again, the science has been there. We've known this for many, many years, and there have been some gains made. Dental and oral health is more available in Ontario for younger families. Everybody gets the opportunity to go now, and we are making some gains for adults to have access to dental care if they can't afford it on their own, which is huge, right? We're learning. But I don't think that everybody understands the significance, and that the oral health is deeply connected to our overall health. So people with gum disease, for example, have significantly higher risk of stroke. Regular flossing is linked to lower dementia risk. Oral bacteria can travel through the bloodstream and impact the heart, brain, joints, and so much more. So we're talking also about connections to literally heart disease, diabetes, kidney disease, and dementia, and even hospital outcomes. I think all of us have known somebody who's got hospital-acquired pneumonia. And poor oral health is now recognized to be a major contributor to this. And this was really surprising to me, especially in our vulnerable populations. So let's just let that sink in for a minute. This is not just about cavities, but this is about life or death in some cases. And I don't think very many people think about taking the time that we need to actually clean people's mouths while they're in the hospital and incapacitated or not well enough or strong enough to do it on their own. So even within short stays, without proper care, this can increase the risk. And yet oral health is often kind of treated as an extra, like brushing your teeth is just about comfort and routine. But in reality, the mouth is like a doorway to the rest of our body. And if there's a wound, there's a pathway for inflammation and infection to travel systemically. So bringing it back to the work that we do, and in terms of, I'm a social worker and a therapist, and I do assessments for people who have very complicated mental health and learning conditions, let's talk about individuals with ADHD, with autism, with trauma histories, with FASD, and other sensory processing challenges and executive functioning challenges. This is where it gets even more, complicated, but vital that we adjust our approach to this and realize that toothbrushing is not simple for some people. Flossing is not automatic, and sensory sensitivities make oral health care overwhelming. I've got countless examples of people who didn't brush their teeth, but then would when I would remind them regularly. And I can remember one fella in particular, like every time he brushed his teeth, he gagged, he choked, it was painful, he almost threw up. I mean, who would want to do that? Especially without any kind of support or those kinds of reminders. I think that would be the last thing on your agenda if every morning you felt sick and it was so hard. So when we say things like just brush your teeth or what's wrong with that person's teeth are so terribly dirty and his breath is not good, we're missing the bigger picture. What this is often about regulation, it's about sensory safety, it's about executive functioning and being able to remember and plan and having supportive environments. And if we don't adapt our approach, then we are kind of unintentionally contributing to increased health risk. So this is why I kind of wanted to bring this topic back to our kitchen tables, because this conversation I don't think happens enough. Everybody and every parent I know wants their kids to brush their teeth. But I do know that when you're picking your battles, I think this is one that might slip a little bit naturally because it is hard and it hasn't been seen as so consequential, I don't think. So this conversation doesn't just belong in research papers or policy meetings. It belongs in our homes and in our schools and in our communities so that we can all make an effort to, ensure that kids and youth and adults are as healthy as we can be. So we need to start asking, how do we support oral health in a way that is more accessible? How do we reduce the shame and the blame? How do we ensure affordability? How do we support some of our most vulnerable individuals? Because here's the truth. We cannot separate oral health from mental health. We cannot separate oral health from physical health. And we cannot continue to treat it like it's an extra or just something people should do by themselves. So it's, here's another conversation to start. I hope that you've appreciated, I hope that you've learned a little bit throughout this discussion and maybe thought about things a little bit differently. And as always, my hope is that you bring it back to your kitchen tables. Now, make sure that you check out my website because there are some links and some resources, especially for individuals who may have some hidden sensory issues and ways to promote good oral hygiene. And again, recognizing that it is far more difficult for some people. And this is not an intentional, I don't want to brush my teeth, I won't brush my teeth. It's like, I can't right now, or this is really difficult and I need some support. So once again, it's about getting curious, asking what's getting in the way, what support do people need, how can we make this feel a little bit more safe and doable? Because when we understand better, we can do better. And sometimes the smallest shifts, like supporting someone to brush their teeth safely and consistently, right side by side, can have the biggest impact on their health and their confidence and their connection with the world around them. So once again, check out my website for more resources and more information around this topic. And as always, thanks so much for bringing this home to your kitchen tables. Angela.